Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 528 of our pharmacotherapy series, which majors in anxiety disorders. The first case reads, LTV, a 32-year-old man, has been employed as a teacher for the past 10 years. He has had an excellent work record until 8 months ago, when excessive absences and a tendency to become easily upset at students and co-workers became noticeable. On clinical assessment, LTV complains of being on edge, irritable, and tense, with frequent stomach upset and diarrhea. He has no history of mental illness. However, he admits to being stressed and worrying too much about insignificant things. He cannot seem to control these symptoms regardless of how hard he tries. LTV denies any symptoms indicative of panic disorder or obsessive-compulsive disorder, abbreviated as OCD. LTV's physical examination is unremarkable, and his family history is only notable for his sister, who is described as a nervous person. LTV denies past or present use of any illicit substances and drinks 3 to 4 beers at social events, which he has not enjoyed recently. His mental status examination reveals the following. Regarding his appearance and behavior, LTV is neatly groomed and dressed and speaks coherently, but he constantly fidgets and taps his right foot. Regarding his mood, LTV is anxious and worried about the clinician's evaluation and admits to occasionally feeling depressed and hopeless because of his anxiety. He often has difficulty falling asleep, but generally remains asleep throughout the night. Regarding his sensorium, LTV is oriented to person, place, and time. Regarding his thoughts, LTV denies any auditory or visual hallucinations, or suicidal or homicidal ideation. LTV states, at times, that he is unable to relax, particularly in the classroom around his students. His work has been difficult for him lately, and the principal has told him that his job is in immediate jeopardy unless he improves his performance. LTV states that he just wants to be able to perform his job like he used to and be able to chill out and get back to his old life. His insight and judgment are good, and he is motivated to obtain treatment. The physician's provisional diagnosis is generalized anxiety disorder, abbreviated as GAD. So my first question to you reads, what clinical features of generalized anxiety disorder are present in LTV, and how can his symptoms be assessed objectively? LTV exhibits the following target symptoms associated with generalized anxiety disorder: excessive worry that is difficult to control, irritability, tension, and inability to relax. Other typical symptoms of anxiety present in LTV include gastrointestinal problems, upset stomach and diarrhea, being startled easily, and fidgeting. These target symptoms are not necessarily diagnostic of any particular disorder, but other factors in association with these symptoms are consistent with generalized anxiety disorder. The absence of physical or other psychiatric illnesses, as well as use of any illicit substances and lack of recent use of alcohol, excludes possible secondary causes of anxiety. The 8-month duration of symptoms is consistent with a diagnosis of generalized anxiety disorder, and LTV's age is consistent with the usual onset of generalized anxiety disorder. More importantly, the symptoms are causing significant occupational impairment for LTV and interfering with his quality of life. Therefore, a diagnosis of generalized anxiety disorder is appropriate in LTV. The Hamilton Anxiety Rating Scale, abbreviated as HAM-A, is a useful assessment tool to evaluate clinical anxiety, and it is the standard instrument used in generalized anxiety disorder clinical trials. A Hamilton Anxiety Rating Scale score of greater than 18 is generally correlated with significant anxiety, and a reduction of score to 7 to 10 is associated with no symptoms, defined as remission. The Hamilton Anxiety Rating Scale can be used to assess baseline anxiety symptoms in patients such as LTV and to monitor response throughout treatment. The Sheehan Disability Scale is a patient-rated instrument, which is commonly used to assess functional impairment caused by generalized anxiety disorder and other anxiety disorders. It measures 3 domains from 1 to 10. A score of 1 reflects mild disability, whereas a score of 10 suggests severe impairment. My next question to you reads: based on the information presented in LTV's case, how can it be determined whether treatment is indicated? What factors should be considered in choosing the most appropriate treatment for LTV? LTV meets the diagnostic criteria for generalized anxiety disorder and is suffering significant disability from his anxiety disorder. He also has insight into his illness and desires treatment that will enable him to improve his job performance and quality of life. Appropriate treatment of generalized anxiety disorder can help achieve these goals and is therefore indicated for patients such as LTV. Treatment options for generalized anxiety disorder include both pharmacologic and non-drug therapies. Psychosocial treatments such as cognitive behavioral therapy, abbreviated as CBT, can be effective in treating generalized anxiety disorder, but use of these therapies alone is generally reserved for patients with mild to moderate symptoms. In LTV's case, prompt treatment is needed because his job is in immediate jeopardy owing to impairments associated with his anxiety. Therefore, pharmacotherapy in combination with psychological therapy, if available, is indicated in LTV. Among potential drug therapies, short-term use of benzodiazepines, maintenance with selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, such as duloxetine and venlafaxine, and buspirone are all considered first-line treatments for generalized anxiety disorder. A primary consideration when choosing among these options is whether any comorbid psychiatric conditions are present. Antidepressants are the recommended initial choice for patients with concurrent depression, which is common in generalized anxiety disorder patients. Other medical or psychiatric disorders may also be present, which can guide selection toward a treatment that may be dually effective. Another important consideration when selecting treatment for generalized anxiety disorder is how quickly therapeutic effects are needed. Benzodiazepines reduce anxiety within a few hours, whereas antidepressants and buspirone have delayed onsets of anxiolytic effects. Medication cost is another potential factor, and generic benzodiazepines or selective serotonin reuptake inhibitors are inexpensive options. In LTV's case, a benzodiazepine may be a good initial choice because of the need for quick symptom relief relating to his problems at work. LTV is young and healthy with no past or present history of substance abuse or alcohol use that might make benzodiazepines unsuitable for him. Although LTV drinks beer on occasion at social gatherings, he has not participated in these events recently, and he should continue to avoid alcohol if a benzodiazepine is initiated. Generalized anxiety disorder is often chronic, and antidepressants or buspirone are recommended over benzodiazepines for long-term treatment. Therefore, one of these agents would also be appropriate to use in this case. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 529.